I don't know that COVID will ever be over, but when we're through this now second round, maybe I'll be able to really process how I'm feeling, but I feel like I'm in that fight or flight mode.
The amount of loss that we have experienced, it's devastating. And I don't know how to get anybody's attention any better to just think about the common good of their fellow human being.
I can't touch numbers. I don't understand what 230,000, 240,000 deaths looks like. So when the news says we've reached a new death toll, I don't understand that. But as a frontline healthcare worker, I can understand the humans behind those numbers, and that every single one of those was a life and a person that mattered and a person that is gone.
My mom got it in March. It was really hard. Sorry. It was so scary because being an ICU nurse and feeling helpless, like you can't even help your own family member, is just terrifying. Keeping my phone on high volume, waiting for the phone call that she was gonna need to be intubated. You keep thinking in your mind, did I say enough? Did she know that I love her? Lucky for me, my mom ended up getting better, but it took her about probably 4 to 5 months to recover.
It's very wearing. As a healthcare professional, you go in there because you want to make a difference. You want to help people. You want to see them get better, reunite with their families. Not being able to have the families in here is not just horrific for the patient, but also as a care provider, you're trying to meet those social and spiritual needs that the patient has, and their support system is not there.
And there's a lot of us healthcare workers that will never forget the things that we've had to see and do. And I just ask that you try to think beyond yourself and beyond those numbers and really think about the lives.
The fact is, it is real. My family and I had COVID. I have asthma. I wear a mask 12 to 14 hours a day. It is hard. But watching my sats drop into the 80s when I had COVID is harder. Not being able to breathe with that is much harder.
I'm proud to be a nurse. I'm happy to be here. I love my patients. I love their family members, and I think that my coworkers are incredible. But it can get taxing when you have constant poor outcomes. Sometimes you go home and you cry in the shower. You know, I think a lot of the time I'm just kind of like here present, and I don't really want to think about what's going on, because if I did, it would devastate me and I wouldn't be able to be present for my patients.
There's a lot of people suffering, and it's not just about dying. There are countless more that will have lifelong disabilities from this. Not just physical or mental, but also financial.
Everyone's saying it's the year of the nurse, you know, healthcare heroes, and the thing is that we can all be heroes just by doing one little thing, and that's just wearing a mask and keeping our 6 feet.
It does make a difference. It will save lives. It has. We've done it before. We've watched the numbers drop. This is something that we need the community to help us to save lives.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.